Thank you very much, Helen. And we have been along beside each other for a very long time, haven't we? Every child that I've seen with brain tumour at Great Ormond Street came to me because they had a visual impairment. So I don't have a wider perspective, but I know a lot about children who have visual difficulties, and quite often unexplained visual difficulties as well, which we will come to. And even here, over the years, I've met children and adults who've said, when I go to the optician, my vision is normal, but I know there's something that doesn't seem right. And there are children and adults who are struggling with vision as a very key part of their long-term consequences of a brain tumour. So let me just make sure I'm turning things correctly. Wait a minute, there we go. Living with a visual impairment, for some people, it's an actual definite loss. They're an older child. They remember their life before when they could see. And it brings with it incredible uncertainty for the child, for the family. And the variation in severity of vision reduction is very, very noticeable when you work with children. There are those who are highly affected and those who are more mildly affected, but it is still significant impact on their life. And of course, for the older child, and we have to think of the whole age range, for some children it's a very major loss, a major disability, bringing with it a great deal of distress, anxiety, and of course for the family. I've seen a lot of young people who've become much more clingy and frightened as their vision is changing, and it affects everyday functioning. Am I getting this? Wait a minute, is it changing? Wait, that's it.
The slide changing.
Yes, slide changing? There we go. What am I doing? Oh, that's it. Thank you very much. Am I getting, that's the right thing. I think a key thing with the very young child, and when we talk about causation, we need to remember that for the very young child, and in fact, if you look at the guidelines across the whole of childhood, one of the first red flags for the family, the caregiver, for teachers, is that the child is losing vision. So this is happening before any treatment. It is one of the biggest red flags. It is what brings many children to an ophthalmologist, who of course is part of the diagnostic pattern. And visual disturbance across, if you look at all the red flag warning signs throughout childhood, visual change, a change in vision, is the first presenting sign that gets everybody concerned about the child. There may, of course, be other signs, but vision change is a very important area. Now, one of the things I remember when I've talked here before in the past is being asked by families and by children and users, I've been asked, we don't really understand why the child is visually impaired. And we've got to remember this is children with many different tumours in different parts of the brain. So there's a lot more that we still really have to learn. I mean, wonderful talk, and I'm coming back to Stefiana's research study, but we understand more about optic gliomas than we do about other tumours that may be from any part of the brain. But I think an important part to understand is that we think of vision from the eye, but the visual system is a very unusual system. It seems really a bit unwise in some ways, but it's one of our ancient brain systems. The vision goes in through the eyes, but then it has to travel right across the brain. It switches, the optic nerves switch over, it's something we call the optic chiasm. It goes through all these optic radiations right to the back of the brain, the visual cortex. In fact, it seems quite a lot of networks. It's incredibly extensive networks. And then when it gets to the visual cortex at the back, that is only where we're starting to get basic perception. And then we have these visual association areas that go into what we call the temporal, the parietal, and the frontal lobe. All parts of the brain are involved in different aspects of vision. When you understand that, you start realizing that if any damage happens to any brain network, it might be affecting vision, which is why an area I'm going to talk about later today, cerebral visual impairment, is a major complex disability. Any part of brain networks might be affecting some aspect of vision. So this is perhaps one of the most important things to know. And of course, as Stefania said, a great deal of visual maturation goes on in the first year of life, the first few years of life. But the brain vision remains incredibly sensitive to injury. And any of you who know adults who've had strokes, different kind of vascular events, car accidents, different kind of brain injury, the brain is very, very sensitive to vision changes if there's any injury at any stage of life. So, wait a minute, I'm still getting this wrong. Am I getting that right, or did I miss one out? I think I haven't worked this one out. Okay, there we've got it. So, first signs, red flag. You may be getting blurry vision. You may be getting loss, and some of you may live with this, loss of what we call the peripheral vision, which is really what your fields, really what you're using all the time when you're making judgments to go through narrow areas. You may have some degrees of double vision, wobbly eyes, nystagmus. You may have a squint, and early on a squint can cause in itself vision reduction. We call it amblyopia in the cortex. You may have difficulties tracking moving objects or seeing things in the distance or seeing things when things are more crowded. Now, we know that the increased cranial pressure that is there when there's a brain tumor before any treatment may itself be causing some of the damage. There's the papilledema, which affects the optic disc at the back of the eye, but there's also pressures where the tumor is sitting. The tumor might be sitting itself on an optic pathway, particularly the optic nerve, the optic gliomas. So some of the tumors, about 50%, if I'm correct, of the of tumors, pediatric tumors, are what we call deep brain, which means they're going on in the center of the brain. It's one of the reasons why they're hard to reach. But that is also where the visual networks go from the eyes to the back of the brain. So particularly things like optic glioma and craniopharyngioma on the pituitary, near the pituitary gland, they are sitting where the optic pathways are. So you can imagine that where the tumor is, with and without any kind of treatment, just sitting there. And this is actually of relevance, whether it's malignant or benign, its location may be causing damage because it's taking up space where networks would be developing. So we're getting to that. So one of the things about Stefania and all my colleagues here at Great Ormond Street, wonderful study on the optic pathway, a number of points I just want to pull out, so they're in yellow, is the optic pathway glioma is one of our early tumours. So it's very young children. And of course, these were 81 children diagnosed before the age of 3 years. Now, there's something very important about that. So 33%, when they first presented, had bilateral visual impairment, which means you're getting perhaps very little vision. By the time you're coming into medical care, you've lost a great deal of vision. And you're starting not to see, or if you see anything, it's very blurry. Now, the key important thing under the age of 3 years is you don't talk very much, and all of our learning, all of our development depends on vision, particularly in the early years. But in fact, for the whole of our lives, we're learning all the time through vision, but pre-language, we are 100% dependent on vision for a lot of learning. So you start realizing that this child, this very young child, not only there's a health major crisis, but there's a developmental crisis. And wonderful pediatricians I've worked with in neurodisability over many years have always caused early loss of vision is a major crisis, and it's an area that I've worked with over many years. So even, of course, as we can see, as Stefania showed, there's long-term implications, the visual impairment. It's very interesting hearing about new medical targets. But even with new medical targets, months, years might be going by where a child isn't seeing, and that is really a very serious area of concern. So we concluded, of course, the conclusions that for the very young children with optic pathway glioma, this is a major problem. So what would one want to be seeing to be in place? And this is now where I start getting on my political messages as well, because for years, and I'm part of the developmental vision clinic, or was at Great Ormond Street, we have worked very, very hard to say that any baby or young child with vision loss has an urgent need for developmental vision neurorehabilitation. And by that, I'm using the term neurorehabilitation quite widely for all infants and preschoolers under the age of 5 years, apart from all the inputs from the ophthalmologists who will do everything with their oncology colleagues to try and work on preventing vision loss. We have an urgent need for highest quality home-based early intervention for babies and young children with visual impairment. And that we use that early intervention to work on promoting vision through different kind of behavior ways, but we also use it for developmental promotion. Now, over the years, I've seen many young children, very young children with visual loss in the clinic where we're giving guidance. And in 2005, myself with my neurodisability colleagues, pediatrician colleagues, we were invited to start through the early support program, the developmental journal for babies and young children with visual impairment. Now, why is this program important? It grew out of the work of our clinic, a lot of research, and research by our own team and others. It is now the only, it's the only publicly available structured early intervention framework for infants and younger children. It's designed for 0 to 3 years old, but it can be used with older children, and it's incredibly valuable for children who are also losing vision around 4 or 5 years of age, because you as the parent have to learn new ways of helping your child. They're not interacting with the world in the same way as they were before. They've got to learn a lot of new skills, and you too as the parent have. So we cover all areas of development. You developmentally have a tracking journal, activity cards, and the important thing is that this developmental journal is now used all around the world. We're translating it into different countries, and in 2019 was the end output of our own scientific evaluation. We were funded to evaluate the success. It's already used nationally, but there were quite a lot of services that weren't using it. So we did an observational study. We followed through 100 babies, and we looked at eye disorders because that's a little bit more straightforward when you're looking at the impact of visual impairment. But the key thing to know is that the evidence is there. We're the only program of its kind internationally. And just to tell you what is on this slide, I'm not going to go through the tables, but the key messages from the slide is that those babies, we saw them at 1 year old, and then 2 years old, and at 3 years old, and then later we saw them at 4 to 7 years old, and we're about to hopefully see them again, and they're now 12 to 15 years old. But those who are on the program showed greater advances in their cognitive and language development. Their behavior was less withdrawn because being visually impaired, the big tendency is you can become a lot more emotionally and behaviorally withdrawn. And the parents had less parenting stress who were getting the program, and they had higher satisfaction with professional support. So it's now being used in over 100 services nationally who have the license, which we provide through UCL, and internationally, over 20 countries around the world, and growing all the time. So just what do I want to also see for older children and adults? Quality of life outcomes is very important. Stefania mentioned them. So if we look at a different group, and am I just got another few slides. So if we looked at craniopharyngioma, again, sitting near the optic tracts, this is a study that was carried out in the Toronto Sick Children's Hospital in Canada. It's been recently done by Michael Wan and colleagues, and Drake's laboratory team. These children presented at a mean age of 9 years old when they first showed signs. The most common presenting feature included vision loss with 31% of the children. So they were showing it before any treatment started. And if you look at them 5 years on, 29% had visual decline. 47% was showing that decline. Of that group, 47% were showing it within 4 months of diagnosis, and it remained then continually in different levels in follow-up up to 8 years after diagnosis. But a little bit different from the optic glioma, and maybe quite a few of you here looking at how many put your hands up. There are those who have absolute total blindness, but with the group in the craniopharyngioma, it tended not to be so many who were blind, fully blind in both eyes, but 58% in their study had visual impairment in at least one eye. Now, one of the things that's interested me over the years is increasingly we now know that if you've got one eye affected, you may have some problems higher up in the visual system. We used to think if you've got one eye all right and one eye affected, that everything would be all right, but it was not necessarily. And if we look at there's increasingly, and I think, as Helen said, research is so important because we've got to show the facts and figures. It's a bit boring presenting it like this, but it's terribly important to make our cases. So if we look at children with astroglial tumours, which of course includes optic glioma, but other glioma tumours, 22% of adult survivors of childhood astroglial tumours, so at least 5 years post-diagnosis, had a visual impairment. So we're talking about very significant, and I suspect that these proportions are an underestimation because I think other children and adults have undiagnosed visual problems that no one has yet diagnosed. But of those being bilaterally blind, that group, when they looked at the other children, adults who had childhood astrogliomal tumours, this was a 2016 study, American study. They were more likely to live unmarried. I think always 10 years on, nobody gets married anymore, but that seems to be, if you're a parent, and you've got adult children, you realise that marriage has gone out. But anyway, it's still an important message that adult survivors of childhood astroglial tumours with bilateral blindness were more likely to live unmarried, more likely to be dependent on their parents, and more likely to be unemployed or dependent on others for care and unemployed compared to those with the same kind of tumours who didn't have visual impairment. So quality of life and life prospects is very affected. So my final kind of take-home message for this, and I'm going to be talking about it later, is firstly, I think throughout life we should do more regular monitoring of vision. But we need very skilled, and it involves the multidisciplinary team. It's not just how are you performing when you have your eyes tested in the optician. It's do you have also some visual perceptual problems? Because if those haven't been diagnosed, they could be affecting you in many different ways. I'll talk a bit more about that this afternoon. So we need to consider all brain tumours, wherever they are, that you might have undiagnosed visual perceptual problems. They're very easily missed. They're not understood yet well. We miss them in all kinds of ways at the moment, and this is an international problem. So this afternoon I'm going to be telling you about our new international consensus guidelines. So the main key message I want to give really is that we need, for any child who has any visual difficulties and for any adult, because we need better diagnoses. I think there are a lot of adults who aren't diagnosed actually, and that affects them in many ways. A psychological really adaptation to vision loss when it first happens, but we need all the same ongoing supports that we do for anybody who has an eye disorder and visual impairment or cerebral visual impairment in every aspect of their life. And we may well have a lot of young people who don't have their disability properly understood. There's so much focus on the tumour, or no focus at all if they're adults, that this area is not being properly diagnosed, made sense of, and the right help being put in. So really my take home is that we need a systematic focus on vision loss and impairment. Visual impairment is one of the major disabilities in life, and it needs totally to be understood, supported. Anyone not supported is at a very high disadvantage if they're trying to work in the occupational environment, in the social environment. It's a huge impact. So the multidisciplinary paediatric and adult neurodisability team, including neuropsychology, is very, very essential for the kind of assessments we can do together, which go beyond ophthalmology alone, and all the early and later neurorehabilitation. So thank you very much.
Thank you very much.